I want to talk about red lists and amber lists because, well, you know, one of the big questions at the moment is we have this variant, this new Indian variant spreading around the UK, and one of the suspicions, in fact, one of the likelihoods is that it came in on flights from India. And one of the questions is, why was India not added to the red list sooner? We know that Pakistan and Bangladesh were added to that red list, which means obviously you have to do a hotel quarantine. Also, if you're not a citizen, not a resident, you can't come to the UK. We know that that Pakistan and Bangladesh were added early in April. 2nd of April was the decision. Why was India left off for so long? Well, here is what the Health Secretary Matt Hancock had to say about that just earlier on.
The truth is that when we put Pakistan on the red list, and indeed Bangladesh, the positivity of those arriving from Pakistan and Bangladesh was 3 times higher than from India. That's why we took those decisions.
Now, here's the thing. I want you to remember 3 times higher, and he said this is the truth about the evidence they were seeing. Well, it certainly might be Matt Hancock's truth, but, you know, if we look at the actual data, there's a different truth. We're all talking about kind of whose truth these days. This is what the data that was collected by the NHS, the Test and Trace, suggests around that period, end of March, early April, when Bangladesh and Pakistan were added to the red list, and I've got India in there as well. And you can probably see there's a difference, isn't there? Look, India, 5.1% positivity rate, so basically 5.1% of those tests coming back positive. Pakistan, 6.2%. That's not 3 times higher. It's nowhere near 3 times higher. And look at Bangladesh, actually below India when it comes to that positivity rate. So I don't quite understand what Matt Hancock was talking about. Maybe he has other data that he hasn't shared with us, but this is the government's own data collected by Test and Trace, which covers precisely this period, 25th of March to the 7th of April, that we're talking about, 2 weeks before India was added to the red list. So it just looks odd. I can't, frankly, understand it. Maybe we'll hear more from the Health Secretary about it in the coming days and weeks. But nonetheless, that's one bit of the data. They were looking at prevalence, so looking at how much COVID there was in these countries to try and get a sense of whether people should be allowed in or not. But they're also looking at something else, variants, just how many of these variants of concern there were in these countries. At the time, actually, the weird thing, by the way, about that Matt Hancock statement is, at the time that those countries were put onto the red list, we were told it was all about variants. We weren't told it was about positivity. But anyway, leaving that aside, doesn't seem to be quite in tune with what he was saying. Let's look at variants and the proportion of those tests. Remember, this is just travellers coming back from these countries. The proportion of those tests that were testing positive for variants of concern. You can see a lot of them in Bangladesh. So I wonder whether actually what the Health Secretary meant was really the Bangladesh decision was about variants, whereas it wasn't for Pakistan. But look at India, right in the middle there, and more than half of all of those tests that were being sequenced from India coming back positive for variants of concern. 2 weeks before the decision was taken to put it onto the red list. And when you consider that there are more people coming from India than indeed from Bangladesh to this country, the sheer number, so we're talking about number of people bringing variants that had been detected, was higher in India than either Bangladesh or Pakistan by a long way. In fact, actually, when we look at all of the countries or places where variants were detected coming from, India at the top of the list. So more variants coming from India than anywhere else in the world 2 weeks before it was added to the red list. But this raises a kind of broader question, doesn't it? Because clearly a lot of the focus right now is on India and why it wasn't added. But there's also a question about what is the rationale anyway for this red and amber decision? How are these decisions made? And if we look at the countries which are on that list and just rank them by the positivity rate, so again, the higher these bars are, the greater the level of positivity in these countries when travellers came across. And you'll notice something odd. Look at the colours. So the amber, slightly yellowy ones, those are the amber list ones, obviously, and the red bars are red list countries. And it's not entirely clear what the pattern here is it? So, for instance, OK, look at the very top, Mali, Yemen. Very high levels of positivity there in Mali and Yemen, actually around 20% of tests coming back positive. It's odd in many senses, by the way, because a lot of the data coming from there is not very reliable, so this gives a better sense of what's really going on in those countries. Big outbreaks, it seems. But nonetheless, look, they're still on the amber list, whereas countries like Angola, for instance, the DRC, Democratic Republic of Congo, are on the red list. So what is the rationale there? It's not entirely clear to me. It's not clear, for instance, why the UAE has lower positivity than most places in Europe. That's been on the red list for a long time. But you can see, just look how far down it is on this kind of ranking of just how much COVID-19 we're detecting in travellers coming from these places. Really very low indeed. Or by the same token, I mean, there's some rationale for some of these decisions. Look at Philippines. Very low level of, not very low, but low by the standards of these bars. Low level of positivity, but a 75% variant rate. So 75% of those tests coming back positive for the variants of concern. So that's the concern with the Philippines. So that makes sense. But in that case, why not put Ghana on the red list? That's on the amber list. It's got higher level of positivity, so more COVID prevalent, and more variants coming back from Ghana. So there are some weird things going on here. And the problem really is that the government hasn't published its methodology about why some countries are red and why some countries are indeed amber. India is a clear example of it, but there's, as you can see, questions across the board there. When we find out more about it, we'll let you know. But for the time being, the government a little bit unclear about how these decisions are being taken. And in the meantime, let's talk about the Indian variant. We know it is starting to spread elsewhere around the UK. We can just kind of zoom in to different parts of the country. For instance, Bolton, 210 cases in the past 2 weeks. I might just actually show you. It's a chart, a similar chart that I've shown you before, but it is worth bearing in mind. Have a look at this. We're going to break down those cases, and this is all cases, so not just the ones with the variant, by age. And look, it's going up very sharply indeed in Bolton for under 60s. But here's the thing. That's under 60s, OK? And that's kind of varied across that age group. Now have a look at over 60s, and that's pretty flat, isn't it? So that's quite encouraging. That's quite encouraging because that suggests there might well be the gap between those two things. There might well be a bit of a vaccine effect, and we'll continue to monitor, particularly that bottom, that blue line at the bottom, to see whether that starts to rise. It is rising, but there's just such a gap between the two of them, suggesting those vaccinations. People over 60, of course, more likely to be vaccinated. Those vaccinations do seem to be working against this variant, whereas for under 60, it's going up very sharply indeed. But we know as well it's not just Bolton. We know actually in Bedford, you've got 50 cases in the past fortnight as well. And the suspicion is it is spreading. It is spreading around the UK, but worth just looking and seeing if we see the same pattern, because that would be encouraging, wouldn't it? Here in Bedford, you can see that cases of COVID for under 60s, and remember, these are all cases, but we're getting a sense here that a lot of these are the Indian variant. Under 60s going up, not half as fast as we saw in Bolton, but now look over 60s, and again, the gap is opening up. So that's pretty encouraging. Same thing from there as we're seeing in Bolton as well. And finally, it's worth just underlining, all of what we're talking about here is happening within this very tiny area. You can see on the far right, this is just total number of cases, the very tiny number of cases across the UK, down to the lowest levels, certainly since last summer. And that is the encouraging thing, really. Even if this variant does indeed spread around the UK, provided this chart remains relatively low, that is good news, but we're just going to have to keep an eye on that in the coming weeks, and also just frankly try and understand why these decisions are being taken about red and indeed amber list countries. We'll bring more to you on that when we understand it ourselves.